One of the new techniques, or relatively new techniques, because I've been doing it for about 6 years now, is injecting plasma, or PRP, platelet-rich plasma. This is your own blood. Your blood is drawn and inserted into either a smaller tube, this size, or a larger tube. This is an 11 milliliter tube. This is a 22 milliliter tube. I use plasma to heal tissue. There's a chemical in here, a surfactant, that when mixed with your own blood and centrifuged in a centrifuge spinning machine, extracts your growth hormone, your stem cells and collagen, and concentrates it. Then I draw that out with a syringe and I inject it into the target area, whether it be bad knees, bad shoulders, torn muscles, torn ligaments, or if you're thinning hair, into your scalp. Injecting into the scalp, I fan the injections. I insert at one point and inject as I withdraw, and back and forth from one end to the other, getting the whole target area, and that stimulates hair follicles to rejuvenate. This is a 23-year-old boy with thin hair, and here's his hair a year later after a series of 5 injections of plasma. The injections were every 3 months or so. Okay? Hair grows at different cycles. There's a growth phase, a rest phase, and a hair falling out or shedding phase. So you really want to inject the patient during their growth phase, but you'll only get about 1/3 of their hair at that time. That's why it usually takes at least 3 syringes on a monthly basis, 1 a month for 3 months, to cover an entire area and get all the hairs that you need to re-stimulate. You know, when I say the hairs, I mean the hair follicles that grow the hair. Now, if people have really, really thin hair, those follicles may have to be stimulated more than once. So that's why, in this case, he needed 5 syringes to accomplish this. And the cost of this is $550 for a small syringe. When I'm injecting joints, I can inject 2 knees with 1 syringe, or $750 for the larger syringe, which gives me twice the volume, so it's really a bargain for the patient. But I can inject an entire scalp with this, or an entire face, as I've done on my own face several times. I'm 66, and I've been doing plasma injections for about 2 years now, and it's done a nice job tightening my skin. It's not a filler. It stimulates healthier tissue growth. So I have a stronger dermis now, so that I don't have as lax skin as I would at my age. Okay.